Hello and namaste to all of you. This is Javin Chalo Singh from Department of Physiotherapy and Diagnosis from Jyoti Vidyapeeth Women's University. So in past lecture, I've talked to you about dietary fibers, their importance. And for today's section, I'll be talking with you about the nutritional importance of lipids. So most important lipids that we know of that are present in our body are triglycerides and cholesterol. So what are neutral fats and triglycerides? So basically, fats, they provide a concentrated source of energy. And in developed countries, the percentage of calories derived from fats, they may be as high as 40%. But in developing countries, they may be as much less as around 10%. So I've already told that fats, they provide the most of the energy, but at the same time the oxygen consumption for the and production of energy from fats is too high. That's why we use carbohydrates as our basic source of energy. So a minimum intake of lipids is essential since the requirements of fat soluble vitamins and essential fatty acids are to be met. So fats, they increase the taste and palatability of food, and they are favored as a cooking medium. Now, visible fat or fat consumed, such as butter, ghee, oils, and recommended daily intake of visible fat is 10% of calories or 20 grams per day. In pregnancy, it's 30 grams per day, and during lactations, it's 45 grams per day. Now, what is invisible fat? So, invisible fat, a fat that is a part of other food items, such as in case of your egg, fish, meat, cereals, nuts, oil seeds. So even cereals, they contain 1 gram of fat per 100 gram, and more than half of essential fatty acids in Indian diet is in the form of invisible fat. Now, what is cholesterol basically? Cholesterols are basically related to your heart diseases. So the atherogenic effect of cholesterol and the risk of coronary artery disease in couples with hypercholesterolemia. So hence, it is always advisable to take dietary intake, which should be restricted. So food items which are known to be rich in cholesterol, such as your egg yolk, liver, brain, and kidneys, they are consumed in limited amounts. And vegetables, cereals, and pulses, they do not contain any cholesterol. So, on the other hand, vegetables, sterols, they will inhibit cholesterol absorption. So, saturated fats, they raise serum cholesterol, while unsaturated fats, they lower it. So, therefore, unsaturated fats, which are in your vegetable oils and fish oils, they are mostly preferred. So the polyunsaturated fatty acids, or your PUFA, they are present in vegetable oils and fish oils. So they are in vegetable oils, they belong to essential fatty acids, and they are precursors of prostaglandins and excretion of cholesterol. And they reduce the cholesterol level in blood, and they are anti-atherogenic. Now the omega-3 fatty acids from fish oils, they decrease the plasma lipoproteins, that is your VLDL and LDLs, and thereby decrease the risk of coronary artery disease and the content of PUFA in oils. So high fiber diet content, it can also reduce serum cholesterol, and it can lower LDL fraction and raise HDL fraction. So LDL is your bad cholesterol, so that obviously needs to be lowered down, whereas HDL is your good cholesterol. So higher the amount of HDL, it will be good for your body. So whole cereal, pulses, leafy vegetables, fruits, they contain good quality fiber. Now trans fatty acids, that is TFA, are atherogenic, and they lower the HDL level and they elevate the LDL level. Now TFA are present in dairy products and hydrogenated edible oils, and it is widely used in food industry. since it increases the shelf life of fried food, cooking media containing PUFA, and fast food preparations. They have high content of trans fatty acids, and trans fatty acids they adversely affect endothelial function and aggravate insulin resistance and diabetes. So it is high in processed foods and bakery products where hydrogenated vegetable oils are used for cooking. Now, what is the recommended dietary intake of fat? So the idea of fat intake is about 15 to 20% of total calories. So out of which about 25 to 30% may be of PUFA, that is your polyunsaturated fatty acids. And this will be total of about 20 to 25 grams of oil and about 3 grams of PUFA for a normal person. So excess of PUFA, that is anything in excess is deleterious. So excess of PUFA may lead to production of free radicals. Now, and these free radicals, they are injurious to cells, and PUFA should not be more than 30% of the total fat. So moreover, the fat content, it should be such that saturated fatty acids, your SPA, SFA, a monounsaturated fatty acid, that is your MUFA or BUFA, and polyunsaturated fatty acid or your PUFA, that's your PUFA, may be in the ratio 1:1:1. Like SFA is to MUFA is to PUFA should be 1:1:1. Now, further cholesterol intake should be less than 250 mgs per day. Now, the cholesterol content of different food items is different. So, hence, egg and whole, in whole it contains 300 mg per 100 grams of cholesterol. Egg yolk contains 1330 mg per 100 grams of cholesterol. Your liver contains 300 to 600 mg per 100 grams of cholesterol. Brain contains 2000 mg per 100 grams of cholesterol. Butter contains 280 mg per 100 grams of cholesterol. Your ghee contains 310 mg per 100 grams of cholesterol. Meat and fish contains 40 to 200 mg per 100 grams of cholesterol, whereas milk contains 10 mg per 100 grams of cholesterol. Now, there are various sources there are various types of PUFA, that is polyunsaturated fatty acids, that you have read in your lipid chemistry. So the examples are your linoleic acid, linolenic acid, and arachidonic acid. And one more is there, timnodonic acid. So linoleic acid contains of 18 carbons, whereas it belongs to omega-6 family, and it contains 2 double bonds, and it is present in your vegetable oils. Whereas linolenic acid, it contains 18 carbons, and it belongs to omega-3 family with 3 double bonds and present in vegetable oils. Whereas arachidonic acid, it contains 20 carbon atoms belonging to omega-6 family, having 4 double bonds and are present in vegetable oils. Same way, timnodonic acid, it contains 20 carbon atoms belonging to omega-3 family with 5 double bonds and present in your fish oils. So there are various fatty acids which are present in oils. So when you see the classification of fats or oils, there comes your butter, ghee, your safflower oil, cottonseed oil, coconut oil, and groundnut oil. So butter or ghee have saturation level of 75% and mono unsaturation level of 20%, whereas polyunsaturation level of 5%. Whereas your safflower oil, it contains 9% saturation and 12% mono unsaturation and 79% polyunsaturation. Same way, the cottonseed oil, it consists of 26% saturation, 19% mono unsaturation, and 65% polyunsaturation. Same way, the coconut oil consists of 86% saturation, 12% mono unsaturation, and 2% polyunsaturation. And on the other hand, that coconut groundnut oil, it contains 18% saturation, 46% monounsaturation, and 36% of your polyunsaturation. So in past sections, I told you about the carbohydrates and energy that is produced by the carbohydrates and from your sucrose, and the starch, which is the most common carbohydrate which is present in our diet. And also in one of the sections, I told you about the dietary fibers and how are they helpful during your nutrition and in your digestion. Also, today we covered about the nutritional importance of lipids in your diet. So in further sections, the third most important macromolecule that comes apart from your carbohydrates and fats is your proteins. So we'll look into proteins in the next section and about the nitrogen balance. So until then, if you have any doubts regarding carbohydrates and proteins, do contact me. And until then, take care and goodbye.